is the statement by the Minister for Health and Social Services, COVID-19 vaccine strategy, and a call on the Minister for Health and Social Services to speak to the statement. Vaughan Geffin.
Thank you, Deputy Presiding Officer. Yesterday, I published our national COVID-19 vaccination plan for Wales. The plan was published on the same day as we commenced daily reporting of the number of vaccines administered in Wales. As of this morning, more than 91,000 people across Wales have now received their first dose of one of the 2 approved COVID vaccines. This marks significant progress, given we are still just over a month since NHS Wales mobilised the biggest vaccine programme that our country has ever seen. The plan reflects months of detailed delivery planning and sets out our national strategy and priorities for the coming months. The plan sets out 3 key milestones. By mid-February, all care home residents and staff, frontline health and social care staff, and everyone over 70, and everyone who is extremely clinically vulnerable or the shielded population will have been offered the vaccination. By the spring, vaccination would have been offered to all the other phase 1 priority groups. This is everyone over 50 and everyone who is at risk because they have an underlying health condition. Completing all groups identified as priorities in phase 1 will protect those groups in which we understand that 99% of all avoidable deaths occur. By the autumn, vaccination would have been offered to all other eligible adults in Wales, in line with any guidance issued by the Independent Expert Joint Committee on Vaccination and Immunisation. By the autumn, the aim is that 2.5 million people in Wales will have been offered immunisation, all within a matter of months. This is a mammoth task for NHS Wales. It is worth noting that no decisions have yet been made on phase 2 and how to prioritise that phase of the rollout. The JCVI will, however, provide advice on the next phase for the 4 governments of the United Kingdom to consider. The milestones in the plan are predicated on sufficient supply of vaccines being available. We have received assurances from the UK government that supplies will be forthcoming. However, ultimately, this is a matter outside of the Welsh Government's control. The plan also includes 3 markers, which we're aiming to achieve as part of the journey towards achieving milestone 1. These are that by the 18th of January, all frontline Welsh ambulance staff will have been offered their first dose of the vaccine. This is part of our aim to vaccinate all frontline health and care staff as soon as possible, given the pressure that our NHS is under and the critical role that our health and care staff are playing in this pandemic. By the end of January, all care home residents and staff would have been offered their first dose of the vaccine. Whilst many care home staff attended our vaccination centres for their first dose of the vaccine in the early weeks of the programme, outreach into care homes was difficult because of the well-advertised challenges associated with the Pfizer-BioNTech vaccine. They are a priority focus following the introduction of the Oxford-AstraZeneca vaccine last week. And also, by the end of January, our aim is for at least 250 general practices across Wales to be part of the delivery model. The role of primary care is a critical element in our programme. 250 practices coming on stream in a matter of weeks illustrates the opportunities for scale presented by primary care. Scale is one thing, but another key consideration is accessibility. And primary care solutions will ensure vaccines are offered closer to home for those that need it most. The plan lays out our medium-term approach for vaccinating 2.5 million people in Wales. If the last year has taught us anything, it is that things will change. Our plan will be updated at points to reflect those changes. It will also be updated as we move through the milestones and greater clarity emerges on the next steps, particularly with respect to phase 2 of the programme. However, I do need to remind members and the watching public that the situation in Wales at the start of 2021 remains very serious. Cases of the virus are very high, and a new, more infectious strain of coronavirus, the Kent strain, has emerged right across the UK, and is circulating in all parts of Wales. This is a race against the virus, and the vaccine programme provides us with great hope. Reaching the finish will be a marathon effort over the coming months ahead. The vaccine is not a quick fix, but I am confident that Team NHS Wales will deliver a vaccination programme that we can all be proud of, and it will help to save many lives. Just as our NHS, local government, the military assistance being provided and volunteers all have a part to play in delivering the largest vaccination programme in history, we all have a part to play to keep Wales safe, to keep washing our hands regularly, to maintain a good distance with other people not from our household, to wear a face mask where required, and yes, to make sure that we're providing good ventilation wherever possible. We all have a part to play in helping to keep Wales safe. Thank you, Deputy Presiding Officer.
Thank you. Andrew Archie-Davis.
Thank you, Deputy Presiding Officer, and thank you, Minister, for your statement this afternoon. If I could place on record my sincere thanks to all involved with the vaccination campaign, because the intensity of the effort must have been huge and will continue to be huge and demanding as we go forward. Could I ask a series of questions, please, Minister, in relation to the plan that you have put forward yesterday and given the statement on today? It is well documented that regrettably here in Wales we are behind other parts of the United Kingdom. How will the plan enable us to catch up and overtake the other parts of the United Kingdom in the rollout of the vaccine? And what lessons have we learned from the start of the campaign that needs to be ironed out? We heard yesterday that 2/5 of 80-year-olds in England have been vaccinated. Can you update us today how many over 80s have been vaccinated here in Wales? Because certainly in my mailbox, I'm getting lots of constituents of that particular age bracket addressing their concerns about not being contacted. Yesterday, only 5,121 people were vaccinated here in Wales. How will this plan enable the rollout of the vaccine to speed up the numbers beyond that 5,121 that's been done on a daily basis? And can you confirm that if the Welsh Immunisation Service is now up and running? Training for vaccinators is also critically important. And as we go forward, it is going to be vital that we can bring vaccinators on stream to help in the national effort. Can you confirm what measures you have taken to facilitate the speeding up of training for vaccinators and indeed the ability for retired medical professionals to come back into service to help in the national effort? You refer to the second phase in your statement. I'm assuming that means the second round of vaccines, but I'd be grateful to understand exactly what you mean by the second phase. But I'm taking it to mean the second round of vaccines and when people will be called up for those vaccines. So I'm assuming we have to wait for more information to come forward. This morning, myself and the constituency member for the Vale of Glamorgan were approached by a Barry care home where the vaccination team had turned up with little or no PPE to perform the vaccinations within that care home, other than masks. Can you confirm that under the plan, PPE will be an integral part of the delivery mechanism of the vaccination programme in Wales, and there's a plentiful supply for PPE, so there's no reason why teams should be out in the community delivering the vaccination without PPE? It's important also to understand how many no-shows are actually happening when people are booking themselves in. Have you any numbers that you could facilitate members with this afternoon to show the no-show rate at vaccination centres here in Wales? And when will all counties have a vaccination centre? The First Minister was asked on this specifically in First Minister's questions, and I note today Barry, the largest town in Wales and the council area of the Vale of Glamorgan, does not have a centre, as does Pembrokeshire not have a centre designated. Are you in a position to tell us when that map might be filled in so all counties in Wales will have that vaccination centre? And finally, it has been alluded to the fact that to speed up the vaccination programme, there is the opportunity for 24/7 vaccination. Is this something that's under active consideration under the plan, Minister? And if it is, are you able to tell us how this might accelerate the speed of vaccination across Wales? Thank you very much.
Minister.
I thank the member for his series of questions. Sorry, there's been a problem in my computer. I'll just get rid of this. So in terms of the series of questions that he's asked, I think he asked a couple of questions that were essentially the same question in a different way. The plan that I've announced yesterday will help us, and it sets out how we're going to speed up the rollout of the vaccine, and that is in particular in relation to use of both the Pfizer-BioNTech vaccine, but also the Oxford-AstraZeneca vaccine. The significant increase in primary care, and I should say I had a very constructive meeting with the Royal College of GPs earlier today, will allow us to have a significant reach in terms of access and speed. And that will come alongside not just the first 2 weeks of the Oxford AstraZeneca vaccine that we've got. And you'd have heard the First Minister say that we've had a bit over 20,000 for each of the first 2 weeks. But we're expecting a much bigger increase in vaccine supply for the third week. And so getting primary care up and running and ready is really important for that third week, where we'll have much greater supply. I've seen some of the concerns that some primary care deliverers have had, that they could do more if they had more supply. But we're actually running with that Oxford AstraZeneca supply, with the supplies that we've been given. But I do think people in all parts of Wales should take some assurance from the fact that we expect a much more significant supply to come into Wales, and will then be delivered in Wales from the next week in particular. On the not just the points about access, I think it's probably worth dealing with your point about vaccination centres. We expect every local authority will eventually have a mass vaccination centre, but I think that perhaps there's a confusion between a symbol and the reality of access. And delivering the vaccine through primary care with the Oxford AstraZeneca vaccine will mean much greater ease of access to people. When you've got several hundred general practices working, whether from their own premises or others that they'll liaise with in conjunction, especially with local authorities and health boards, that will practically mean that access will be made much easier. And I don't think the public will be much bothered about whether there's a triangle on a map in their local authority, or whether they can have easy access to a vaccination venue when it's time for them to receive their vaccine. That will both be about people going to those venues, whether in a local health centre, whether a hotel, a converted restaurant, a bowls pavilion, or indeed a mass vaccination centre. I think the public want to know, when will I get easy and good access? That includes our delivery, of course, in care homes. On your question about the Welsh Immunisation Service, yes, it's up and running. No, I can't give you the figures on the number of no-shows today, and I don't have a figure to give you the over 80s, but when we're publishing our weekly dashboard, we will be providing more information on some of the detail that you've asked for. And in terms of the lack of content, everyone will start to be getting a letter from today onwards from health boards and local government partners to set out the approach locally and to give people some of that reassurance that the health service hasn't forgotten them. When it comes to training vaccinators, we've worked with people in HIW and across the service to make sure we make it as easy as possible. I've seen some of the concerns in every nation of the UK, including, of course, in England, where people are concerned the process is too bureaucratic, including for retired staff to return to practice to help with the programme. So we are looking again at what that is possible to do. Now, it's entirely possible that I don't need to make a single decision on that. I've been very clear about the policy directive to make this as quick as possible and as easy as possible for trusted staff, whether volunteers or not, to deliver the vaccines. If there is a need for me to make ministerial choices, then I'm more than prepared to do so to speed up the programme. When it comes to phase 2, I was actually referring to phase 2 in terms of the priorities list. When I think your question that you were really asking about the second dose, and that's partly about supply. So expect to see the second dose starting in earnest once we get through to March, when more and more people will be starting to get their second doses come through, and then into April as well. And that is part of what we'll be doing. And you will have noticed we're already reporting on how many people had their first dose and their second dose in the totals that we provide. So we'll be transparent about the progress we're making. I'm not aware of the individual issue about the Barry Care Home you refer to, but PPE supply is available. It's in plentiful supply. I think members right across the political spectrum can be very proud of the way that we have procured and supplied PPE here in Wales throughout this pandemic at good value for money for all of us, for all taxpayers, and without a single whiff of corruption in the way that PPE has been supplied and procured. And when it comes to 24/7 suggestion, that is something that health boards are looking at. I'm not setting an objective that everyone must have a 24/7 delivery model. I want the best and the quickest delivery model available. And if we set an objective that everyone must deliver 24/7, that may not achieve that. I think some health boards will trial it to see if it really does not just expand access, but speed of delivery. And I look forward to learning from that. We won't know until that's essentially been tried. But like I said, my directive to the system is to go as fast as possible, as safely as possible, but to do so in a way we look after our staff and our volunteers who are delivering the vaccines and make it as easy as possible for the public to get those vaccines as well. Thank you, Deputy Presiding Officer.
Thank you. Rhys Piorwerth.
Diolch, Dirprwy Lywydd. Thank you for the statement. It's good to have the chance to make a few comments and ask 4 or 5 questions as well. I'm glad we now have a rough guide to the timetable. Welsh Government is hoping to follow. I wrote to the Minister on Saturday evening. I asked for targets so we could measure performance against them. But can I just have a little bit more detail, please? You talk of hitting priority groups by spring. You know, when is spring, for example? Are we talking start of spring, end of spring? I think we just need a bit more detail on that. The Minister has told us that daily vaccination number updates will now be given, but I think we need more than a universal figure regularly. As I asked in that letter, we need a daily update on how many of each type of the vaccine we've received, how many of each type of the vaccine has been distributed to each health board, how many have been administered, and to which priority groups on health board and local authority areas. And I'm pleased to hear others calling for detailed data as well, including the Royal College of Physicians. This is really important in giving focus to your work and in letting the public, as well as us, whose role it is to scrutinise government. We need to know how we're doing, and we need to have confidence that we are on track. Can I also ask for a tightening of the prioritising within the health and care workforce after reports that some non-patient facing staff have been vaccinated? I know that one health board says that's because vaccines have been given to some non-patient facing staff at the end of the day to stop any prepared doses having to be thrown away. I've suggested that perhaps we could follow the Israel model where unused doses could actually be offered to the public on a first come first served basis at the end of the day. I also pointed out to other innovations in Israel that have made them world leaders in vaccination, including 7-day working and drive-through vaccination centres. For example, you say maybe you don't want 24/7. We certainly need the 7. I'd also like to know what you're doing on the ground to ensure that your own priority list is being followed. I know, for example, that GPs in my own constituency wanted to follow your guidelines, get all care home residents done in one day, all in one go, 500 of them. They are the #1 priority. But instead, doses were given out to do some community vaccination of 80-year-olds and over. And don't get me wrong, we need our most senior citizens in the community vaccinated with real speed, but that doesn't actually follow the priority list you have given to us. Perhaps you could comment on that. If we have a priority list, we need a strategy to stick to it, surely. I'm hearing from other GPs in other parts of Wales frustrations at what happens, at what appears to them to be poor strategy. Sending vaccines to each surgery in turn rather than build up area-wide capability. I quote one who's made public comments in the Hywel Dda area here. If you're unlucky enough to be a patient in one of the later allocated surgeries, then you have to wait for the vaccine, even if you're in a top priority group. This should be about priority groups, not postcodes. And finally, there are other priorities. I hope you'd agree with me on that. Beyond the top 9, and I'm not suggesting deprioritising any of the top 9 priority groups, but be it the police or teachers or others in public-facing roles, can you explain how you intend to expand that priority list to those who need protection most outside the priority groups we now have? I'll end with a sporting analogy. People have compared how things are going with the rollout in Wales with other UK nations. It's natural people do it. We've been falling behind. First Minister has said it's not a race, that it's a marathon, not a sprint. Those who take their marathons very seriously pretty much get out of the blocks at sprint pace, and the winners pretty much sprint the whole 26 miles. I'm not talking about a race to beat other nations. That's neither here nor there. But we do need to know that we are racing forward as quickly as we can for the benefit of the citizens of Wales, and speed is of the essence.
Thank you. Minister?
Thank you for your comments and questions. Just to make clear, I've said repeatedly, this is a race against the virus. It's a marathon effort over many months, and we all want to move as quickly as possible. I don't think I can be any clearer about the approach of the Welsh Government and the direction that our National Health Service is taking. And I really do think we should all be very proud of what our staff are doing, staff who are under pressure. And as ever, there are times when criticism of the programme can be taken personally by staff. I appreciate that most members will say they're not criticising staff, they're criticising me as the minister. But there is a need to think about how we question the entirely legitimate question that members will have for me and for Health Board leadership, and the impact that has on our staff who are working under incredible pressures. And turning to your first point about spring, spring is the season, and the season doesn't go into, it's not a never-ending season. So you won't have this sort of idea as David Jones, when he was in the Welsh office, suggested that spring and summer actually then went on at some point into the autumn and the winter. The reason why I've given spring as an outline timescale is that really is part of where we are with vaccine supply. So if I had absolute certainty of vaccine supply through to the end of April, I could probably give you a much clearer timescale. But some of those are uncertainties that, to be fair, I don't think the UK government are going to be able to give me a cast iron guarantee on all deliveries up to the end of April right now. We'll give more detail as we review the plan about when in spring we think we'll be able to complete all of the phase 1 priorities. But just to give some reassurance, by the end of spring is when we expect to do that. If there is a challenge in vaccine supply, if there is a challenge in delivery, then we're completely upfront about that. You'll recall that we had a COVID outbreak in in the Cardiff mass vaccination centre. So we lost more than 2 days of delivery because the outbreak had to be dealt with, the place had to be cleaned, and staff who weren't contacts had to be brought in to continue running the centre. So it is always possible that events will intervene. It is always possible supply will intervene. But if there are any of those challenges, we're absolutely upfront about what the position is, and crucially, what we are still able to do to make sure the programme carries on. In terms of the significant detail that you're asking for in terms of the daily figures, I just don't think that is the priority issue for us at this point in time on a daily basis. We'll have weekly detail that will give much greater colour about the delivery of the programme, and I'm sure that once people are used to that weekly set of data, that people will be ready to ask questions and to look at what that data provides in detail. If I were to try to make a choice to say that I wanted that level of detail on a daily basis, we'd need to put more time, energy and effort into data entry and to analysis to get it right, and I think we'd end up having to give significant caveats about the information. There's a choice about whether that investment in data entry to meet with the members' demands for individual daily accounting is the right choice, as opposed to wanting to have a greater focus and priority on the delivery end. But there will be regular information each week that we'll provide to members and the wider public. On a point about prioritisation, I've been asked this question a couple of times. There appear to be a handful of examples that I think health boards have looked at to understand what's going on. I don't have any problem at all with if there are end-of-day doses, to make sure they're not wasted, being offered to health or care staff who are nearby, or indeed to the public. I don't think that's the greatest policy question that I need to address as a minister with a responsibility for vaccine delivery. My concern is that we adhere to the prioritisation list we've got, that we make sure we don't have leaking of people coming into that group who are somehow gaming the system, which is the concern that I've had, that some people have expressed to me that somehow they've been able to jump the queue in a way that isn't simply about a handful of doses left at the end of the day that I don't think anyone has any particular concern about. I've checked again with health boards, and my understanding is that they are running through the prioritisation list properly, but it's up to all of us to do the right thing. And if you're offered a link to jump the queue over other people who are undertaking patient-facing work, then there's a responsibility on you not to queue jump and put yourself ahead of other people who are putting themselves in harm's way each and every day on our behalf. When it comes to 7-day working, we're already seeing lots of working over the weekend, and I do expect that every health board will be undertaking some 7-day working in the vaccine delivery of the programme. I hope that's helpful, just to be straight about that. And general practitioners are working with health boards on priority delivery. They're also working with local government. Every health board and set of local government partners are meeting over the coming days. They haven't met already, to run through the detail of their programme, and they'll be able to go through what they're able to do with primary care to make sure they're appropriate premises, because as I said, many primary care premises will be a fit for purpose premise to run a vaccination centre from, a local one. Some of them though, and we'll all be aware of those general practitioners who are working from essentially converted terraced houses, may not be appropriate in terms of a venue for vaccination. But this is about how we have appropriate venues within local communities that are in much easier reach for people to allow access and an increase in volume and pace. And when it comes to the question about occupational groups and the priority list, I think I've been very clear about this, and I'm happy to reiterate the position. We have from the JCVI an endorsed list of priority groups that will help us to avoid 99% of avoidable mortality. That's phase 1. If we add into that groups who are outside that, then what we will do is we will deprioritise people who are in the most vulnerable group. Whether it's teachers, police officers, or any other group, if they come into phase 1, then someone else will be deprioritised who is of greater need. Think about it this way: if you're 13th in a queue and you move up to 10th place, then you can't say, I'm not asking for anyone to be deprioritised, I just want to go to 10th. The people who are ahead of you are now behind of you. And the very clear advice we have had is that if we were to do that for whichever the group of frontline workers it is, then that would mean that we would knowingly be making a choice that would put other people at risk, and that would cause avoidable hospitalisation and mortality. And I'm grateful to the member for raising the point. It allows me to reiterate that that's why we have this approach. It's not a finger in the wind list. It really is about protecting the public and about saving lives. And I know that the member understands that and will support that approach. Other voices, of course, have taken a different view and have demanded that we take an entirely different approach. I hope members across the political spectrum understand that's the choice we're making. That's the decision that I've made here in Wales, and I'm not going to make an alternative choice that may keep an individual group of stakeholders happy for a few minutes, but will, I'm sure, cause much greater concern and consternation, and frankly lead to avoidable mortality.
Thank you. We've had 2 questions and we're 2/3 of the way through the allocated time for the statement. So if I could just gently remind people about the need to get everybody in. I've got quite a few speakers. Alan Davis.
I'm grateful, Deputy Presiding Officer. I have 2 questions. The first relates to the speed at which those over 70 and with a condition that makes them clinically vulnerable will be offered a vaccine, because they will be clearly at elevated risk, and it's important that we're able to address those. But also people who share households with people who would not fit into one of those vulnerable groups, but clearly the household is a single family unit. And if we are vaccinating one part of that unit, it seems to make sense intuitively to vaccinate the whole of that family unit to provide that protection around a vulnerable individual. The second question is about unpaid carers. We all know that unpaid carers are the great army of people who take care of some of the most vulnerable people in this country. What is the place of unpaid carers? I think if there's a gap in this strategy, it is those people who are taking care of vulnerable adults and children every day. And finally, Minister, members of staff at special schools, I noticed that you were saying that those staff who do provide care, intimate care and support for children and children who are particularly vulnerable in special schools will be a part of the priority list. And I was wondering where they would be within that and when they could expect to receive a vaccine. Thank you.
Thank you. Minister.
Okay, thank you for the questions. So on the speed of the over 70s and the clinically extremely vulnerable, otherwise known as a shielded group of people, we're expecting to have offered all of those their vaccination by the middle of February. That is for them as opposed to the whole household. We have asked, and there have been a number of questions gone back to the JCVI that are in around this space, including the question on unpaid carers. They'll continue to look at the evidence of how we can provide the greatest benefit in terms of avoiding harm and mortality, but I understand entirely the case that is made around unpaid carers. it is entirely possible to receive some revised advice, because that's exactly what happened with special school staff who provide intimate care. We looked again, and they're analogous essentially to social care staff who provide intimate care as well. So they will be prioritised within this first phase group, and so we'll be looking to make sure that they receive offers of vaccination. It's a relatively discrete group of staff, and it is because their care is directly analogous with the care that you'd expect some frontline health and care workers to provide. I'll ask again with our Chief Medical Officer, but the questions we've gone back to the JCVI about both questions, but my understanding is that on unpaid carers, they'll come in priority groups. They may be in a different priority when we get into the second phase. A number of those carers, if they fit into other categories of the first phase, will be vaccinated according to that category. You know that a number of unpaid carers are actually within the age profiles we're currently dealing with in phase 1, but not all of them will be. And so we're looking at whether there's a way to describe it in a way that people will understand, that the NHS will be able to meet and match and provide the reassurance that I know that the member is seeking and quite right asking on behalf of his constituents.
Thank you. Caroline Jones.
Thank you for your statement, Minister, and I'd like to take a moment to thank all the scientists and volunteers who've made it possible for us to be discussing this vaccination programme. And yesterday marked 1 year since the first ever recorded death of COVID-19, and in just 12 months we have approved 3 vaccines. This is truly remarkable. Minister, how will you be monitoring the effectiveness of the vaccine over time, especially as the period between doses is vastly different from those undertaken during phase 3 trials? I too am concerned about vaccines being wasted due to people not attending. So I am concerned about what plans you have to minimise the wastage, and have you considered just having a list of people, especially teachers or police officers, who could be called in at the end of the day to be vaccinated, ensuring not a single dose of this precious resource goes to waste. Finally, Minister, how will you ensure that people receiving their second dose will be given the same vaccine as their first dose? We have to ensure that we receive sufficient supplies of each vaccine to guarantee that there will be no mixing of different vaccines. And finally, how will you be monitoring this, and what arrangements have you made with the UK Government to secure additional doses of a particular vaccine if required? Diolch yn fawr. Thank you.
Minister.
Thank you for the questions. On the second dose being the same as the first in terms of the type of vaccine, that is certainly what our plan is. I saw a rather unhelpful New York Times story suggesting we might mix them. That's never been the approach we've planned to take here in Wales. And at this point in time, we don't have an issue with supply. If there was a need to do that, then I am more than happy and prepared and capable of going to the UK Vaccines Minister to make sure that we get the right amount of supply to make sure the second dose can be delivered. We'll be able to have that information, not just rapidly, but safely deliver doses of the vaccine through the Welsh Immunisation Service, again built from scratch here in Wales by our staff. On wastage, there is already a call-in approach, so health boards already have a backstop approach to the end of the day if there is unnecessary wastage. Actually, our wastage figures are very good, and I expect that'll be part of the weekly information that we provide. We think we can provide a useful figure on wastage, which should show very low levels of wastage, and again, that's credit to the staff delivering the programme. In terms of having more to learn in the effectiveness over time of the impact of the vaccines, well, that of course we'll learn much of that as we're deploying them. We think from the evidence that we've been provided, delivering the vaccine to the first phase group of people, and once we get through all of them, we'll deal with 99% of avoidable hospitalizations and mortality. That in itself will make a significant difference to where we are. We'll then learn more about the longevity of the vaccine and issues about transmission, if you've had the vaccine or not, as we move through time. But as ever, our knowledge base is not complete. We can be confident that we have vaccines that are effective, are providing high protection in the first dose, but much more to learn for all of us in the months ahead.
Thank you. Susie Davis.
Diolch, Dr. Lywydd. Minister, I'm going to take you back to the phase 2 prioritisation, if I may, as it kind of didn't quite answer Andrew RT's question on this. I don't think any of us is suggesting that the phase 1 rollout be reprioritised in any way, but I want to know whether you're personally sympathetic to the argument that school staff should be within the phase 2 prioritisation alongside those for which we've already had some indication. I appreciate what you say about JCVI, but towards the end of that prioritisation list, it seems to be mainly about age. All governments are saying schools should be the last to close and first to open. So I'd be grateful to hear from you on that. And then secondly, quickly, with the question that Alan Davis raised about staff providing intimate care for pupils in special schools, can you tell us whether there was a reason why this isn't rolled out to mainstream schools, where staff also have to administer intimate care to those children who need it? Thank you. Minister.
Thank you for the questions. To be fair, I think the question about the phase 2 rollout was confused at the start. And in terms of the phase 2 rollout and the question about school staff, of course I'm sympathetic to a range of occupational groups who are working as key workers to keep all of us safe. In particular, whilst we're staying at home, we're relying on groups of people to maintain some sense of normality in these extraordinary times. I also have sympathy for people who work in the police and other services. But the priority list is all about how we save lives. When it comes to phase 2, as I made clear in my statement, we don't yet have advice from the JCVI or our chief medical officers on prioritisation within that second phase. And I will be interested in the evidence of how we can avoid the greatest harm, how we can go as quickly as possible to protect the adult population. But to give you an idea of the sort of differential rate that we're dealing with, the Deputy Chief Medical Officer, Jonathan Van Tam, indicated to ministers across 4 nations in a call not that long ago that 43 vaccinations of care home residents will probably save 1 life. About 100 vaccinations of the over 80s will save 1 life. To save 1 life of a teacher who is under 30 without additional vulnerabilities, you need to vaccinate 62,000 people. So it really does reiterate why we've got prioritisation of the groups we currently have. And when we get into the second phase, we can be confident that we're vaccinating people where there is still a risk, but the risk is much lower. And so that's why we have our priority list approach, and that's why we're taking the approach by prioritisation for staff within that.
Thank you. Guy Lloyd.
May I thank the Minister for his statement and also congratulate and pay tribute to all of those NHS staff who are providing these crucially important services being provided. The situation is grave, as the Minister has said, and I think we need to push the vaccine out to thousands of people as a matter of urgency. The level of the virus remains very high in our communities, and we need urgent action to ensure that Wales gets its fair share of the vaccinations too, because there is a perception out there that Wales is falling behind on vaccination, and people are concerned that the high levels of the virus will bring about new variants again as time progresses and we experience high levels of the virus. It's important that we take urgent action, therefore. Would the Minister agree with me on that?
Minister?
Yes, thank you. And thank you in particular for, again, mentioning our staff who are working under incredible pressure to both deliver the vaccination to protect the public, but also with the ongoing care and treatment from people who are ill from both COVID and non-COVID illness as well. And there is certainly no lack of urgency within our National Health Service and partner organisations for the task in hand. I understand why there is some concern about is Wales falling behind or not. I think that when you look at the progress made over the last week, we went faster than Scotland on a per head basis within the last week, not as fast as England and Northern Ireland. When we come back to look at this in the middle of February and again by Easter, I think people will be genuinely proud of what Wales will have achieved. I am confident that Team Wales really will deliver for all of us in protecting the wider public. Your point about the challenges over new variants arising. So we have the South African variant and the Kent variant that we know spread much more rapidly, and that's caused a real problem in every part of the UK. So you'll be aware, as indeed were all other members who attended the briefing for Health Social Care Committee members today, that there are thousands of variants that have appeared from coronavirus, and they're monitored between the different public health agencies within the United Kingdom. And things only become a variant of concern if they look as if there are difficult or troubling aspects. It's why we are so concerned about the South African variant and the Kent variant. We talk about those, we talk to the Danish mink variant, but we don't talk about the several thousand other variants that have arisen because they've fallen away. So yes, the greater prevalence, I understand where there may be a concern about will this mean there could be more troubling matters, but actually we have a relatively good surveillance system, and in all the variants of concern, the same control measures work. Keeping your distance, washing your hands, wearing a face covering where possible, having good ventilation, but crucially, avoiding mixing with other households. That is the biggest control measure we can all take. And that will help us to have a very different future with as many of us as possible at the end of this journey together once vaccination provides coverage and protection for the whole population.
Rhiannon Passmore.
Sorry, I don't have a question on Jones.
Oh, right, thank you. Mark Isherwood.
Well, thank you very much for calling me. Further to my questions to the Trefnydd earlier when she asked me to, or suggested I raise these with you now. Firstly, given your particular reference to the police, how do you respond to the call by North Wales Police Federation for policing to be considered for some priority on the COVID-19 vaccination programme? As their secretary said to me in writing yesterday, day in, day out, police officers put their own safety, health and well-being at risk whilst protecting us all. Sadly, in North Wales, we've seen many colleagues who have become unwell with COVID-19, some requiring hospital treatment and many more having to self-isolate. And finally, how do you respond to the constituent who wrote to me calling for autistic adults to be given some priority for the COVID vaccine also, whose brother lives in North Wales, has a learning disability and autism. And she referred to the recent research by Public Health England, which found the death rate from COVID is 6 times higher for people with a learning disability than the general population.
Minister?
I think on your final point, that is something that I know that Chief Medical Officer and our Chief Nurse is particularly concerned about, because the figures are there about a more significant mortality rate for people with a learning disability. Our challenge is whether it's actually the learning disability, whether actually there are other underlying conditions. And actually, when you think about it, most of our learning disability adults have a higher number of people who are entitled to an NHS flu jab, and so actually they will be covered within the first phase. If you're like me and you're entitled to an NHS flu jab because of an underlying health condition, not because of your age, although that time I hope will come in due course, then that means that you are in a different place to the list to if I were just being dealt with within my age profile. So there are a range of other categories I think will catch up and make sure that people under the highest vulnerability do get seen in order with their priority. And when it comes to protections for the police, we're already trialling lateral flow testing as an additional protection for the police to help people to self-isolate if they're asymptomatic and to protect our workforce within the police. That's a trial that all forces in the whole of Wales are supporting. In terms of the Police Federation call to be moved at the priority list, I think I've dealt with that extensively, both yesterday in the press conference and earlier today. There is a real impact to moving occupational staff groups around and an impact on preventing the maximum number of deaths.
I
thank the Minister. The next item is a debate on a statement in the draft budget for 2021-22, and I call on the Minister for Finance to make the statement, Rebecca Evans.
Diolch, Llywydd. I am pleased